Welcome to another episode of The Dissection. The Department of Health spent 28.5 million rands promoting the government's national health insurance policy from the 1st of April last year up until this particular point. And this was revealed by the Health Minister, Dr. Aaron Motsoaledi, in a written reply to a parliamentary question which came from the Democratic Alliance. Specifically, it came from their Member of Parliament, Michele Clarke. The minister also mentioned that 77.8 million, which had been allocated in 2019 for national health insurance advertising through digital vibes, was repurposed in 2022 for COVID-19 communication. And this amount of money is actually under investigation by the Special Investigations Unit. So over 100 million in one shape or form has been spent at some level in marketing and communications for the Department of Health, particularly for NHI and also for this COVID-19 communications, which we saw, which was meant for NHI in any event. According to the Special Investigations Unit, Digital Vibes was appointed in 2019 to perform NHI communication services, and this was extended to cover the COVID-19 communications. Altogether, the department allocated 150 million rands to the company in what the SIU actually determined were irregular procurement processes. And as you know, the calamity of Digital Vibes led to the resignation of Dr. Zweli Mkhize, who was a contender and aspiring to become a leader of the ANC, but that scandal totally collapsed him. So Business Day reached out to the health department spokesperson, Foster Mogale, and they asked him some questions. They questioned him as to whether or not he thought the 28.5 million was not an excessive amount. And this is what he said: "I don't think it's a lot, given what was very expensive, which is television advertising. It's necessary to have a broad reach of advertising using a variety of platforms to reach as many people as possible." That's what he said. "I don't think it's a lot." Business Day also questioned Mogale as to why it was necessary to promote the NHI, to which he replied, "Well, comrades, they always say, so he probably didn't say that, but, NHI is policy of the government. Just like other policies of the government, we have to raise awareness. I don't see any problem. We have to make people aware of the benefits and the intended benefits of this government policy." Mogale also clarified that the department only started promoting NHI in July 2024 after President Cyril Ramaphosa signed the National Health Insurance Act in May of 2024. "We started raising awareness, post the signing," he said. This is what was said. So a question is asked by the Democratic Alliance: how much are you spending advertising on NHI? We've got the answer now: 28.5 million rands. The man from the Department of Health says it's not a lot of money. If you think about it, television ads are expensive. We're putting up these billboards, we're putting up this stuff. It's cheaper than TV ads if you think about it. So to assess this claim, we need to have some understanding of the healthcare system, the NHI, and the costs and challenges in the South African healthcare system as it stands right now. So here's what you need to know. Let's start at the high level. The World Health Organization classifies healthcare workers into 5 groups. Healthcare professionals, number 1. Healthcare associate professionals, number 2. Personal healthcare workers in health services, number 3. Health management and support personnel, number 4. And number 5, other healthcare service providers who are not classified elsewhere, which would include medical students, hospital volunteers, members of the armed services. Going back to 1, healthcare professionals includes categories such as generalist medical practitioners and specialist medical practitioners. Medical doctors, specialists, generalists serve a key role in the healthcare provision in health systems. Now, here are the numbers of the doctors in the South African healthcare system, according to the Health Professionals Council of South Africa annual report of 2023. There are 43,901 doctors who are registered in South Africa. the number of active student registrations for the period between April 2020 to March 2024 shows that there are 2,190 interns and there are 11,574 medical students. If you want to know how many physicians there are in the population, there are 60% of the physicians who are working in the private sector. So of that number that I mentioned, 43,901, research shows that 60% of physicians are employed in the private sector, which gives you a ratio of 263 doctors per 100,000. 40% work in the public sector, which gives you a ratio of 35 doctors per 100,000. Let's do a comparative analysis so that you can see whether or not those numbers are good or bad. As of 2023, Canada had approximately 243 physicians per 100,000 of its population. 243 per 100,000. We said that in the private sector, there are 263 in South Africa per 100,000. So compared to Canada, that looks good. Compared to the Organization for Economic Cooperation and Development, the OECD, which has 350 doctors per 100,000 as of 2017 data. So OECD, significantly higher ratio compared to the private sector in South Africa. Looking at Germany, in 2022, Germany had 455 doctors per 100,000 people. So that's significantly high. If we then think about it, it's evident that the South African healthcare system has a globally comparable doctor to population ratio in the private healthcare system, but troubling ratios in the public healthcare system. Because if you look at Germany, 455 doctors per 100,000 versus 35 doctors per 100,000 in the public healthcare system. To reach that average of the OECD, the Organization for Economic Cooperation and Development, which is 350 doctors per 100,000, South Africa needs to add 157,000 more doctors. 157,000 more doctors are needed. Specifically, 157,400 more doctors are needed to get to that ratio of 350 doctors per 100,000 people. So here's some other current shortages and challenges that you need to be aware of. There were 2,000 vacant positions nationally in public hospitals as of April 2024. The national vacancy rate for medical officers was at an average of 14%. This has also been revealed through the parliamentary questions and research. Last year in September, it was revealed in response to another parliamentary question that the total number of doctors who completed their community service in 2023, only of that total number, only 60% of them, or 1,187, were appointed into funded medical officer posts in government facilities. That means 40% of people who graduated and completed their community service did not have any employment. They had to then look for employment in private healthcare, or were forced into unemployment, or were forced to emigrate from South Africa because they couldn't find jobs. So those are the numbers. That gives you an indication of where the numbers stand. What about the costs? We've spoken about numbers. What about the costs? In 2024, the South African government spent 271 billion on healthcare. And we know this from the 2024 budget. And you need to be aware that the South African public healthcare system serves 84% of the population. The combined expenditure of the public and private healthcare systems in 2024 was estimated at just over 500 billion last year. The combined figure is arrived at by adding the estimated 230 billion spent by the private healthcare sector. That's about how much they spend a year, with the 271 billion allocated to the public healthcare sector in the 2024 budget. Last year, on the 15th of May, President Cyril Ramaphosa signed the National Health Insurance Bill into law. It then became the National Health Insurance Act. And the NHI is a health insurance fund. The critical thing that you need to know comes from the Act. Section 2 of the Act states the following about the purpose of this particular Act. The purpose of the Act is to establish and maintain a national health insurance fund in the Republic, funded through mandatory prepayment that aims to achieve sustainable and affordable universal access to quality healthcare services by doing three things. A, serving as the single purchaser and single payer of healthcare services in order to ensure the equitable and fair distribution and use of healthcare service. B, ensuring the sustainability of funding for healthcare services within the Republic. And C, providing for equity and efficiency in funding by pooling of funds and strategic purchasing of healthcare services, medicines, health goods, and health-related products from accredited and contracted healthcare service providers. So this is what the National Health Insurance Act is attempting to do. It's a fund that will be funded through mandatory prepayment. So all citizens, residents of South Africa will be required to contribute to that particular fund. The fund will then become the single purchaser, single payer of healthcare services, meaning that it's buying all of the drugs, paying all of the doctors, all of the practitioners. And this pooling of funds is supposed to actually reduce the cost of healthcare and make healthcare accessible. That's the idea. What are the estimates of the costs of the NHI? How much will it cost to be able to do all of this? The estimates of implementing the NHI vary. The government estimates that they need 200 billion in additional funding to cover NHI. So moving from 271 to about 471. Momentum, which is a health insurance provider, performed an estimation that showed, in their modeling, showed that it would cost 1.3 trillion rands to provide South Africa with the same quality of healthcare as is now provided by the private sector. Momentum basically arrived at this estimate by multiplying the 21,000 rands in annual claim costs per beneficiary of the private sector with the population estimate of 61 million people. So that 1.3 trillion is a little bit on the lower end because the population now is at 63 million. Discovery Health Insurance estimated that if the NHI covers primary care, extended chronic medication, maternity, and prescribed minimum benefits, it would need around 600 billion more than the current expenditure on healthcare. So they're taking it from 271 to 871 billion. To provide advanced cover such as extended hospital stays, specialist procedures, Discovery estimates that the government would require 1 trillion rand in funding to cover the NHI. So it's very clear that if you look at these numbers, before I go to what's very clear and what's not very clear, if you look at these numbers, government is estimating 200 billion additional. Discovery and Momentum, who are opposed to the NHI, are saying this could be 1 trillion, 1.3 trillion. Even if you say, okay, let's meet them somewhere in the middle, the number that you would need maybe is about 500 billion extra to be able to. Government obviously is not going to tell you the full cost. They're going to try to make it seem as affordable as possible. Momentum, Discovery, they may try to make it seem as expensive as possible. I did a calculation by myself just to try to work out, because if you have 230 billion being used to cover 16% of the population, you work that out, and then you actually do get to about 1 trillion in costs to cover all of the population using the same quality of service and cost of service that the private healthcare system is using to only serve 16% of the population. So the trillion number is not an unreasonable number. But if we say, look, let's meet somewhere, right, between 200 million and 1 trillion. Let's say that it's 500. No, that's not really in the middle, but let's say it's 500. So using 500 billion in additional costs, right? Additional costs. You can see that, we're very far from being able to fund a comprehensive healthcare system that caters to everybody without there being private medical aid. Those numbers, as you can see, have to be funded from somewhere. The thinking of the government is that right now, the private medical aid system has this money because it's a fund, right? Private health insurance is a fund. They have this money from member subscriptions, premiums, whatever you call it. So if we just take that money, that 230, and we put it on top of the 271, we're already on 500 billion. We'll be able to provide better healthcare services. That's what they say. That's the thinking. It seems like it's simplistic thinking because it doesn't actually think about the current shortages. I already proved to you that there's a necessity for 150,000 more doctors to be added to the healthcare system, 157,000 more doctors to be added to the system to actually match the quality of care that is provided in the OECD, and also just to almost match the quality of care that is currently provided in the private healthcare system in South Africa. So if you just take the money from private healthcare system and just spread out the doctors more, you're still not going to have the right amount of doctors. You're still not going to have the right ratio of doctors, because all that does is it takes you to 65 doctors per 100,000. And that's not necessarily going to improve the situation by any stretch of the imagination. So if we then know that the NHI is so expensive, that there are already challenges with placing people who've completed their medical service, their community service, then the real question we have to go back to is this: is the cost of of advertising for NHI justified? I don't think so. In light of the information that I've just presented to you, it does not seem compelling to say spending 28 million rands on NHI advertising in under 1 year. And I'm assuming they'll continue to spend this amount of money. So maybe it's about, let's say, 30 million a year or whatever the case may be. It's just a waste of money. It's not the best use of health department funding. And those funds should actually be used to hire doctors who are sitting at home right now while patients are dying in overcrowded hospitals. That's what I think. I don't know what you guys think. Let's have a conversation till the next one.